Hello, I'm Dr. Carol Clark, and I'm a licensed mental health counselor. I'm a certified clinical sexologist, sex therapist. I'm certified in transgender care, and I'm certified in addictions counseling. So I'm 67 years old, and I've been a therapist for more than 30 years. And in my lifetime, counseling different people, I've been asked about my own experience. Am I trans? Am I an addict? Have I ever been depressed? Have I been suicidal? Have I been a victim of trauma? Have I been all the different things that clients come to see a therapist for? And here's the thing. I am some of those, and I'm not some of those. And what I am is well educated in the issues that I treat. And I've worked with a lot of people who have those issues. And what I especially am is very cognizant of the fact that my experience is not that of my clients. So even the things that I am, for instance, I was sexually molested as a child, my experience is mine. It's not like anyone else's. It may have some overlap. There may be some ways that I felt I dealt with it that overlap with my clients. But if I start going there, if I start looking at my clients through the lens of my experience, I do my clients a disservice. Most recently, I was asked, even attacked on social media for being a transgender care therapist, working with trans people when I myself am not transgender. If I was, I would tell you, I would be open. But here's the thing. I've been working with trans people for almost 30 years. I've worked with people around the world from all walks of life, all different presentations, people who identify as transgender, as non-binary, as gender non-conforming, as gender queer, everything, who lean towards being one gender or the other, or pangender, or something else entirely. And it's up to everyone I work with to tell me who they are, how they identify, and what brings them to see me. How can I help them? And I can honestly say that if I was trans myself, that would not be of any particular help to them. Because my experience, again, would be my experience. It wouldn't be theirs. And when I hear people say, well, I'm transgender, I identify as trans, therefore I should be the one to work with trans people. Well, maybe you're a wonderful therapist, and that would be great. And you also need to be extra aware of not bringing your experience into the counseling office where you may, unwittingly impose it on your clients. I've worked in addiction as long as I've worked with transgender people. And I've worked in agencies where I've gotten to witness addicts helping addicts, which is a wonderful thing. Step 12 in the 12 steps, addicts helping addicts. When addicts, though, become therapists, they really need to be extra vigilant to not bring their way of recovery into the counseling office and expect their clients to do it their way. Okay, so a counselor in recovery from addiction can bring a lot of wonderful, wonderful experience to the table. They've done it. They've been there, done that. So they can have a lot of compassion. They can have a lot of empathy. But those are qualities I have as well. And they can bring a lot of the knowledge of, what addicts go through, what they do, what they don't do, how they hide it, their levels of denial, all kinds of things. And that can absolutely enhance the counseling relationship. And then they can also, again, usually unwittingly, say, well, this is how I did it, and so this is how you need to do it. And that's something that anyone who has been through a personal experience, a personal concern, had a personal issue, has to be aware of when they're working with other people. And it's the same with trans people. So I've heard a lot from the trans people I've worked with over the years that when they've gone into therapy, when they've gone to groups, usually groups, not therapy so much, but when they go to group counseling, when they go online and talk to trans people, there can be a lot of judgment, a lot of advice giving, a lot of, this is how I did it, so this is how you have to do it. Now, I'm certainly not saying that trans counselors who happen to identify as trans or other gender identity, that's what they're doing. It is something that everyone needs to be aware of. Just like I need to be aware of not bringing my experiences with my own sexual molestation, with my father being an alcoholic, with all the things that my life experiences. I just have to make sure I stay balanced in the counseling office. A final thing I want to say about this is, as a therapist, I was educated. We therapists are educated about a wide variety of mental health concerns. And then we go through internships, we go through practicum and internship, working under supervision in order to be proficient at counseling, first getting our basic counseling skills down, and then counseling a wide variety of issues. And then we go out on our own, or we work in an agency, and we continue to collaborate to get continuing education. We continue to learn, we hone our skills, and we work with a lot of people. And so hopefully we become good at what we do. And I think I'm pretty good at what I do. And that is to ask the client, what brings you here? Make sure that it's within my area of expertise, that I'm not practicing outside my area of expertise. So certainly someone who hasn't been trained to work with trans people, who doesn't know the issues, doesn't know all the ins and outs, doesn't need to be working with trans people. They need to get training if they want to do that work. But I've had that training, I've had years and years of experience. And that's what I bring to the table. And it would be impossible for me to have experienced everything that every client who comes to see me has gone through. That makes no sense. Okay, with all the different issues out there, anxiety and depression and PTSD and all kinds of relationship difficulties and all kinds of life events, there's no way any one person could have gone through all that. And if I had, I'd probably be completely unable to get out of bed in the morning. Okay, that makes no sense. Okay, so what I bring to the table is my knowledge, my counseling skills, my knowledge of specific issues, my general counseling knowledge, and my willingness to start where the client is, to listen, and then to bring the interventions to the table, to, I give people homework, I help them from a variety of theoretical perspectives. And when it comes to trans people, I can help guide them through the transition process that works for them, that what they need in any given moment. Okay, because again, everybody's journey is different. All right, so that's what I wanted to speak about here and now, because it's becoming more and more relevant. There's more and more trans people coming out, gender nonconforming people who are, thanks to the internet, thanks to just our general evolution, we're hearing more about this. People are feeling able to come out. People are looking for help. Some people are not looking for help, and that's fine too. I'm certainly not dragging people off the street saying, you have a problem and I'm going to help you with it. Okay, but when people call me, when they walk in my office or show up on Zoom, okay, they're going to tell me what they need help with. And then I'm going to help them get where they want to go. That's all I want to do. I'm not here to tell anybody what's right or wrong for them. And I'm not here to impose my personal experiences on them. And that's me. I'm a counselor, and that's what I do. So thank you very much for listening. And I hope that helps some of you who have had that question. How can I counsel trans people when I'm a cisgender woman? Bye-bye.